Hi, and welcome to episode 90 of the Pet Behavior Chat. And today's episode is about preparing for an aggressive dog consultation. And the reason I'm recording this episode today is because that's something that I have actually been thinking a lot about in the last couple of weeks. So I've had a couple of really quite severely aggressive dogs on my patient list. And over the summer, we've actually had a couple of vet students with us, seeing practice with us. And in fact, one of the cases was so severe that I actually told the vet student that I didn't want her to join me on that particular consultation. I usually love vet students or vet interns shadowing me and joining me in my behavior consults. I think it's something that they perhaps don't often get to see. So I absolutely love having them there with me, and I love that teaching experience. But for this one particular case, I actually said, no, from a safety point of view, I think it's better if you sit this one out, because I didn't want to put them at risk. And I also didn't want to create an environment for the patient that was going to cause unnecessary stress. So it's something that we've been chatting quite a bit about in the clinic in the last couple of weeks. And, from time to time, I kind of go over my safety protocols again, just to make sure that everyone's still on the same page, especially the veterinary nurses that might be sitting in with me on those consultations, and also the veterinary front of house reception team, so that they know what to expect when very fearful, very anxious or aggressive patients come into the clinic. Just to make sure that everybody's kept safe from, my team, through other people that might be visiting the clinic at the same time, up to, of course, the caregivers of my patient and my patient themselves. So yeah, I think that's maybe the first thing to mention, is that even if you regularly see tricky behavior cases and you see aggressive dogs, it's always worth going over your protocols again. It's always worth thinking about, what could we change? What could we improve on? And just kind of refreshing everybody's memories around that. And then, of course, if you have new team members joining that maybe aren't quite as familiar with that whole process, then that's something that you definitely need to kind of go over again and brief on again. So I thought it would make a really good episode, because I think, this is sometimes where we do run into trouble, or we can run into trouble, and we're never really quite sure. Even if we've had a lengthy questionnaire and we've seen videos of the particular patient, we're never quite sure what's going to expect us when they come to the practice. And I've had both scenarios. I've had patients where I thought, oh my goodness, they're going to be really, tricky, aggressive, easily triggered, reactive, with quite substantial bite history or aggression history. And then when they've actually arrived at the clinic, it's been different. And then vice versa, the kind of even worse scenarios where you thought, oh, this doesn't actually sound too bad. And then when they arrive, it's actually a lot worse than you were expecting or had anticipated. So yeah, I think regular checks of protocols, that's the first thing. And then I want to chat you through a little bit about sort of what I do before I meet the patient. So once that patient gets booked in with me and I receive their questionnaire, what are some of the things that I do in the run up to the consultation? What are some of my strategies during the consultation? And then what are some of the strategies after the consultation? And this after the consultation piece can also be an interesting one, because oftentimes, you've gotten through the consultation and it may have been quite a tense consultation. And then, and the dog's been in an environment where they perhaps felt uncomfortable and, somewhat restricted for a period of time. And then all of a sudden they leave, everybody kind of sighs a breath of relief, and everyone sort of drops their guard. The dog is potentially quite aroused, emotionally, maybe frustrated because of the restriction to movement during the consultation, even though we try and do everything to keep them as calm as possible and make them as comfortable as possible. But for some dogs, that, consultation period alone is enough to sort of, trigger them and cause them to feel even worse than they perhaps did before. And then, so when they leave the consultation, everyone drops their guard, the dog might be, more aroused. That sometimes is when we can have big risks for aggressive events, maybe bites to the caregivers, or maybe even some altercations with, other patients that might be in the clinic inadvertently if things aren't managed well, or with team members. So yeah, that piece is quite an interesting one, because it's the one that we maybe don't consider so much. So I also want to spend a little bit of time talking about what happens after the consultation and when everyone leaves. Okay, so let's get started with before the consultation. So my process or my procedure is that a client checks in with me, and they receive a really lengthy questionnaire. And it's not until they've filled in the questionnaire and I've managed to have a read through it that we actually confirm the booking and we get them scheduled in and booked in. And the questionnaire is very comprehensive. Like I say, it's about 15 pages long. It asks for a lot of detail, and there's a very long section at the end that asks specifically about bite events and about aggressive events. So I really ask them to go into detail around how many bites they've been, who they've been to, what context they've been in. And I also ask about the severity, which areas of the body were the bites to, were they to hands, feet, face, body? Is it even human-directed aggression? Is it, dog aggressive behaviors? If so, is the dog in the same home, or is it to dogs outside of the home? What are the sort of the types of people that have received bites? Have they been family members? Have they been strangers? If family members, have there been children involved or vulnerable adults? So that I want to understand, how bad is this, and what kind of bite character do we have? What types of injuries have the bites caused? How many bites have there been in total? And, where have the bites been to? And have they been, bites that have been repetitive bites? So the dog, bites, let's go bites again, or perhaps doesn't even let go. So that, in terms of risk factor, for everybody, obviously for the caregivers, but also for myself and my team when I'm seeing that dog in a consultation, that's important information to note, right? So we absolutely want as much detail as we can. I also want to see videos of the dog. We're talking about dogs in this consultation, in this episode, but sort of cats. Similar things would apply to cats, but let's carry on with dogs. I would want to see videos of the dog. However, I absolutely always stress to the caregiver that I don't want them to put the dog into any kind of triggering situation just to get the aggressive or an aggressive episode on a video. So that is absolutely not what we want. We don't want to expose any people to further risk. We don't want to put the dog in that situation. We absolutely don't want, a video of an aggressive event if one doesn't already exist purely by chance. If a video exists by chance, then of course, I'll look at it. But otherwise, I just want to see sort of general daily activities. What's the dog like on a walk? What are they like when they're sleeping? Where do they sleep? What are they around? How are they around food? How do they play? What are the interactions like with other people in the home? Maybe other dogs in the home, other pets in the home. So, and again, I don't want to put anyone at risk. So we're not putting the dog in a situation where they might be aggressive towards another dog or a cat also in the home. But I just want to try and understand a little bit of the dog's general lifestyle. And in that same vein, what I will not do is I will not do home visits to an aggressive patient, an aggressive canine patient. I may do a home visit to a severely anxious dog, fearful dog that doesn't want to leave the home, even though those can also be risky. But I don't do home visits for aggressive dogs. And the reason for that is that I can't control the environment. Now, right at the beginning of my residency, or I think it might even have been before my residency, when I started seeing behavior cases, I did actually do, I think, 2 home visits to aggressive patients. One was sort of a townhouse within a compound, one was an apartment. And it became really clear to me really quickly that there was just no way that I could manage the environment safely and effectively. Maybe, with more time and better strategies, that might have improved. But for me, it was just too much of a risk. I couldn't sort of control, I guess, the barriers of safety or the layers of safety. So that is, where the dog was being kept. Were they behind a closed door? Were they behind a baby gate? Were they safely secured in a crate? Were they tethered? Were the clients able to hold on to them? And then there's always the risk that the client, wants to allow the dog to approach you just so you can see what they normally do. And of course, that's a very, very risky strategy. And sometimes I think also going into somebody else's home, it can be a little bit more difficult to be quite assertive around some things. So whereas when I'm in the clinic, I'm the one in charge. I'm sort of the figure of authority there. It's my home, it's my house, it's my place. And I feel a little bit, I suppose, less socially awkward to be a little bit more authoritative, I guess, in sort of giving direction to the caregivers when they're actually holding their dogs by the leash or things like that. And I'm sure others of my colleagues wouldn't have those same issues. But for me personally, I feel a little bit uncomfortable doing that in somebody else's home. So again, I choose to do that within my own four walls, where I can control the environment and where I can kind of be, I guess, the figure of authority in there. So that's a little bit about home visits, not doing those, having a look at the questionnaire to try and establish what kind of risk we think this dog might be. But as I said, that can always look different when you finally meet them in person. I also want to know a little bit about their training history, for example. You know, have they been trained with aversives, in which case any unfamiliar person could pose a threat. I also want to know, as I mentioned earlier, whether they've been aggressive to unfamiliar people, of which I and my team, you know, I am one and my team also are one. So we want to make sure that, or we want to try and understand, you know, who these aggressive events have been towards, and yeah, a little bit what they've looked like. Okay, so the next piece is, what do we do actually during the consultation? So what do I do to put sort of safety measures in place? And there are a number of things. I'm going to tell you a little bit about how I do it in my consultation room, but I'm also going to give you a few examples of what I've seen in consultation rooms of colleagues of mine, and what they've used. So for me, one thing that's really, really important is to have two doors to the room. So to have an entry and an exit door. Now, the way that my consultation room is set up in my clinic is that a dog does not have to come through the main reception area of my clinic to get to the behavior consult room. There's actually a separate door to the outside. So they basically arrive in the car park, they walk around the back, they walk up a few steps into the behavior consult room, and they never, ever have to even step foot in the main sort of body of the clinic building. And they also leave that way again as well. And that's definitely sort of a safety procedure. It's a safety measure to make sure that we keep other patients safe, that we keep other team members safe, and we don't disrupt the flow of the rest of the clinic by you know, an aggressive or reactive or highly aroused dog coming into the main reception area. Now, the other reason for having two doors is that if something bad happens, myself and my team can get out, maybe also the caregiver. Now, I've been very fortunate that I haven't, touch wood, had many of those events. I have had probably about 2 dogs that have approached, that have kind of lunged towards me while barking. And that's because the dog was resting by the owner's feet, and we got a little bit complacent in terms of having quite a tight hold on the leash. And I moved, or there was a noise or something happened, and the dog associated that with myself and kind of barked and lunged quite quickly towards me, stopped, you know, a few sort of, well, not that far away, a few, I would say, centimeters away, before the owner, the caregiver, then finally got a hold of them and managed to remove them from my space again. And similarly, my team members, so I usually have one team member in with me who's helping me take notes and take some photos if it's appropriate to do so, and just generally help. And we've had some similar situations a couple of times, with dogs also focusing their attention on one of us. Sometimes it'll be me, sometimes it might be the other person. And even though we try our absolute very best to be as non-threatening as possible in the way we sit, in the way that, you know, we don't make eye contact, in the way that we try and throw treats, on occasion, even the throwing of treats has been a trigger. So, you know, learning how to throw treats in a non-threatening way, even that can sometimes be quite important. So yeah, I think, and that's why having that additional exit door is really important. So again, another safety piece. Now, My mentor, she has a tether, like a metal tether in the wall. It's a very kind of strong sort of metal ring fixed into the wall that she will tether dogs to if they are too aggressive. I tried that in one of my consultation rooms, but I wasn't convinced that that was secure and safe enough. I wasn't sure if there was going to be a dog that was going to be big and heavy enough that they might be able to even kind of strain against that. So that's potentially an option depending on the structure of your walls and your building and how comfortable you feel with that. I feel also that some dogs actually got worse when they were tethered and restricted like that. Other colleagues of mine use crates and sort of, I guess, wire crate type sort of dividers or pens. For some dogs that can work really well. It depends very much on how the dog feels about being in a crate. But usually what I end up doing is having quite a bit of distance between myself and the caregivers, making sure that the dog is wearing an appropriate piece of equipment, whether that's a neck collar or a harness. If I feel that the neck collar is very loose and the dog could slip out of it, then we have a couple of harnesses in the room that I would then ask the caregiver to put onto the dogs and attach the lead securely. And I then ask the caregivers to kind of loop their hand through the loop of the leash a couple of times and then just keep hold of the leash. Now, that in itself can be quite challenging because the number of times that caregivers drop the leash or unloop it from their hands, or, you know, they're busy explaining something and they're maybe using their hands to talk, and before you know it, they've let go of the dog. So that is something, you know, when I mentioned earlier about being quite authoritative with directions that I give, if somebody's not paying close enough attention to keeping a hold of their dog, especially if the dog is aroused and has maybe already barked in the room, or is seemingly uncomfortable, or is maybe growling at or staring at us, then I get quite sort of rigorous about that. And every time the leash slips, you know, I'll remind the caregiver, please, you know, loop your hand through the leash again and tighten it, you know, wrap it around again, obviously if it's safe to do so. And that's usually what I end up with, is a dog that is quite sort of closely leashed by the caregiver, sitting on a dog bed close to the caregiver. Some of them even prefer to sit on the couch with the caregiver. That's absolutely fine by me. And when dogs are, I think, as unsettled as that, or if they have a bite history that is severe enough, I will not allow them to be off leash at any point during the consultation. We've also had situations where the dog's been quite relaxed initially and has been looked quite comfortable with, you know, relatively soft body language. We've taken the leash off, but then as the leash has come off, the dog may have approached us, and that has then triggered them, that proximity to us. Or maybe throwing of treats or interaction with them has triggered them, and then we've had them back on the leash again. So that's something that I think, you know, you have to read in the individual case. And of course, reading body language is an absolute must here. You have to be pretty good at reading body language, the most subtle signs, the freezes. The ones that have caught me out are the dogs that have gone still. They've looked like they were resting by their caregiver's feet, and I've moved in my chair, maybe lulled into a false sense of security, become careless for a moment, moved in my chair, I don't know, maybe spoken with my hands or spoken slightly more loudly, and that has been the thing that has then triggered the dog, and they've gone from being seemingly quite relaxed and still to full on kind of lunge towards me. So that body language piece is so important, and not mistaking their stillness for comfort or relaxation is a really big learning piece. And then, of course, you're engaged in conversation with the caregivers. You're trying to understand what's going on. You're trying to be cognitive about what they're communicating to you, while at the same time keeping an eye on the dog's body language and making sure everybody stays safe. It's a little bit of a skill and art to sort of master that. And And I think that's why in the residency program, we do see the first 50 cases with our supervisors in the same room if possible, is because of all of those things, those nuances. The learning curve for me was so steep when I first started seeing cases with my supervisors. And I can remember a case that I saw with Dr. DePorter in the US, where there was a collie that had a bite history that was really quite highly aroused, and this dog was let off the leash. The caregiver was quite an advanced dog trainer, and the dog was let off the leash, and she and I was observing in the room. So I was sitting on a chair next to the back door, and the hospital there was set up in a way that there were people passing by the back door, so behind me, and the dog was kind of associating me with the noises that were coming from behind the door. And that dog fixated on me, and it was literally the most uncomfortable hour of my life. It wasn't fun. So that learning curve is really, really steep, and those safety aspects are really, really important. So obviously that's not everything. I won't be able to cover everything in this call. Some people decide to wear protective clothing. I guess it depends a little bit on where in the world you work and the types of patients that you deal with. I do know that some of my colleagues will wear, leather boots, or, always sort of long sleeves, thick jumpers, maybe jackets. Some of them might even wear sort of metal chain trousers or sleeves. I know also Dr. DePorter, she had a very tricky incident with a Great Dane who responded aggressively, and she now has like a flip chart. No, not a flip chart. Like one of those, like a board that you write on, a clipboard. That's what I mean. She has a clipboard where she has her notes that she writes on, which is quite sort of a sturdy clipboard. It might even have been a metal clipboard. She always has a clipboard now that in case anything like that happens again, she can lift that clipboard up and use it as a shield to kind of shield from any potential threat. So I think people have developed their own sort of ways of dealing with those things through time. But of course, the best way of preventing anything from happening in the first place is by not having the dog get too aroused. And that all comes from providing a very calming environment. Again, depending on, what the hospital is like that you work out of, that might not always be possible. But things like playing calming music, I use Adaptil spray mazes during the consultations, allowing the dog to be up close to the caregiver if that's where they feel comfortable, having some dog beds, having as quiet and non-threatening environment as possible, having the space be as non-clinical as possible, learning to throw treats in a non-threatening way. So literally, as if you were skimming a pebble over water, I think is how it was described to me by my supervisors. So keeping your hand really close to your body and just having the action come from the wrist as if you're skinning a pebble across water. Because as soon as you kind of reach your hand out towards, even if you're throwing a treat, that could be interpreted by the dog as a threatening motion, and that could be enough to trigger them. Not speaking with your hands, sitting side on, not making eye contact with your patient. That can sometimes be hard because you're trying to observe them, you're trying to read their body language, but at the same time, you're trying not to make eye contact with them. So you're trying to look at their body without looking directly at their face. So all of these things are the things that you really need to learn if you are seeing aggressive dogs in your behavior consultations. And then, like I said, the more sort of obvious safety measures, such as tethers muzzled. Actually, a lot of dogs come in already muzzled into the consultation. I saw this a lot when I was seeing cases in the US, that the dogs come in wearing a muzzle. And depending on the individual patient, they either wore the muzzle for the entirety of the consultation, or there was a point during the consultation where we were able to take the muzzle off. And obviously, depending on the type of muzzle, we only kept it on if it was a basket type muzzle that the dog could pant open their mouth through, take some treats through. But those are kind of the other obvious safety pieces. So muzzles, crates, tethers, pens. I've even had a couple of situations where we weren't able to do the consultation in the room. The dog was so reactive in the room. that we ended up actually doing the consultation outdoors. Now here in the UAE, that's only possible in the winter months. It depends very much on your facilities, whether there is an outside space. I do know that some of my colleagues have an outside consultation space. Some of my UK-based colleagues do. So if the dog feels really uncomfortable inside, then they may be better outdoors, but then they might be worse outdoors. So it's about reading that patient, understanding, what their preferences are, speaking to the caregiver. Hey, do you think they'd be more comfortable outside? But then maintaining that level of safety outside. So there are lots of thoughts that go into that. So those are some of the things that I think about during the consultation. And then, as I mentioned previously, be really mindful of who you allow into the consultation. So if I have a vet student and I'm just concerned for their safety and I just don't feel it's the right environment, then I'll ask them not to join. But I also am mindful that I don't want to overcrowd the room. So if I've got, let's say, the whole family coming with the dog, so maybe mum, dad, 2 kids, and and myself and one other person in there already, I'm not going to start bringing a vet student or a vet intern or somebody who wants to see cases with me in at the same time. So it's really making lots of mindful choices around how you organize that space. And then finally is the piece about what happens when the consultation is over, because that is usually the trickiest time. Now, it's possible that throughout the consultation, if you've managed things really well, the dog's been able to settle and calm down. Now, the moment you start to make noises as if, okay, the consultation's over now, I'm going to get the report to you in a few days, we're going to pop out the back to dispense your medications, let's pop the muzzle back on them, or let's make sure that their leash and their harness are attached properly. And as soon as the caregiver makes a motion to sort of half rise out of their seat, then the dog is back on full alert again, and they know something's happening, something's going on. And that might then be as you try and stand up and leave the room, perhaps to go and get the meds or get anything else that you want to dispense for the patient. In that moment, that might be when the dog might start to bark or lunge. So we always preempt that with, something really high value. We'll either throw a handful of really high value treats to keep the dog occupied as we stand up to leave the room, or we might give a licky mat with some peanut butter or some cheese or whatever we've identified in the consultation that the dog really loves. Or we might ask the caregiver to do a few small cues, training cues with them. I don't know, a nose touch, if the dog has that, ask them to do a high five or whatever to distract them as we leave the room. But those moments can be really tricky because everything's all right. Everything's over now. We've made it. And then all of a sudden everything changes, and those can be risky situations. And I have actually, as I was seeing sort of my earlier cases, I would say within the first 100 cases that I saw, I have on occasion gotten up and moved away, and a dog has started barking and lunging towards me. And again, that's a learning curve. We now learn that we preempt in those situations. And I'll always be really clear in saying, okay, everything looks pretty calm right now. However, the moment we all start to shift and move, the moment I get up, the moment you guys go to get coats on, get bags, your dog is going to change again. So we want to be really preemptive. Here's what we're going to do. The person who's in the room with me is going to throw a handful of really high value treats. Once your dog is engaged with those, I'm going to really quietly get up, turn around and leave the room. If your dog barks, make sure you have a tight hold on the leash. If your dog barks, try and distract them, try and calm them down. They may, so pre-warn the caregivers. Your dog may well, I'm expecting them to potentially have a reaction to me getting up and leaving the room. So those are the moments that you want to really manage quite carefully. And they're as tricky as, getting everybody into the room safely and setting things up. Those leaving parts can be as tricky. And especially when you've had a long consultation, maybe this was a 2-hour consult and it's been really emotional and it's been really, intense and everyone's tired. And at the end of the consult, it's so easy to just drop your guard and make a mistake. So those moments, and then also how do we kind of choreograph their exit out of the consultation room? Again, for me, it's quite easy because I have that exit that goes out to the side. But I've also seen cases in clinics where the dog has had to then leave the consult room into a reception area and then leave the building. So oftentimes in those situations, we would try and take payment or, get everything done in the room before they leave. We would check that the coast is clear, make sure that there are no people or that there are no maybe other animals in the reception area. We kind of almost create a clear path for them to leave. We may accompany them out of the building at a distance, just kind of following a distance behind, and make sure they get safely out and safely back to their car. If you can take payment by payment link, or if you have a prepaid consultation, even better, so that some of those logistics, where people getting purses out of their bags don't have to happen, and things can be, as smooth as possible. So this is all fine tuning. This is what we would expect to see from a specialty service. That wasn't how things worked when I first started my residency, but over time, one learns what works, what doesn't work, what are some safety things to consider. And like I mentioned right at the beginning, reevaluating your process consistently, constantly, making sure that you have safety measures in place, that everyone knows what they are, that everyone is aware, hey, I'm seeing a behavior case today, and this is quite an aggressive dog. So we're putting all our kind of high alert, code red, safety measures in place. So that's really, really important as well. So I mentioned that reading body language is one of the most important pieces. And I actually have an amazing course called Learn to Speak Dog, where I deep dive into canine body language, facial expressions, communication, sociability, some of the things I've spoken about today, but some of the things that might be really helpful for you if you are either a professional that is working with dogs in a behavior setting, or if you're a caregiver that is thinking about maybe having a behavior consultation and you're just keen on learning some of these body language signals. So Learn to Speak Dog is a self-paced online course. It has 7 modules. There's about 5 hours of content in there, all broken down into super easy and digestible chunks, modules and lessons. And the first 4 modules probably are quite sort of theoretical. We go through lots of the body language, emotional state, what emotions can dogs go through, what do we think they can't really experience, all of those things. And then the final 3 modules are super practical. So we have a whole module just on enrichment. We have a whole module just on exercises and things you can do to improve your dog's behavioral health. And then we have a whole module that is about my favorite products for behavioral health. And that goes right from equipment through pheromones, diets, and supplements. So a whole range of things. So if you're interested in learning more, especially about canine communication, and as I mentioned, it's so important that we're so good at this, especially reading those subtle signs, then Learn to Speak Dog might be an amazing course for you. And in this summer of 2025, which is when I'm recording this podcast, I actually have a special summer discount of 50% for the Learn to Speak Dog course. I'm going to pop everything in the show notes for you. And yeah, that's it. So I hope that's given you a little bit of an insight, especially if you're maybe a vet or a vet nurse, or a trainer or a non-veterinary behaviorist that is looking to move into seeing more aggressive dogs, or maybe you're setting up your behavior service, which, by the way, episode 85 would be a really good one to have a listen to, which is where I chat to vet nurse Nikki McLeod about her setting up her behavior service. So these are some of the things that certainly I had to think about a lot when I started seeing behavior cases in my clinic. What were going to be some of those safety aspects, and how was I going to set up the room and set things up safely so that they were going to work for everybody. So if you are thinking of either seeing more aggressive dogs or moving into that space of seeing behavior patients in general, then I really hope that you found this useful. Okay, the Learn to Speak Dog link and the summer discount is going to be in the show notes. The discount code is just SUMMER50, SUMMER50, to get the 50% discount. So if you're interested in jumping into that, I would love to see you in there. So that's everything for this episode, and I really look forward to seeing you next week on episode 91. Bye for now.